And now it's a privilege to introduce Dr. Robert Lowe, chosen by the graduating class to be their graduating speaker. A graduate of Harvard College and Harvard Medical School, Dr. Lowe completed his residency in internal medicine at Brigham and Women's Hospital and subsequent training in gastroenterology at Boston Medical Center. He serves as an associate professor of medicine and the educational director of the section on gastroenterology. He directs the GI pathophysiology course and coordinates activities for the fellowship programs. His research interests include the evaluation of new treatments for viral hepatitis, the management of cirrhosis, and the complications of advanced liver disease in the study of liver disorders. Dr. Lowe?
Thank you, Dr. Antman. Graduates, family members, faculty, and friends, it is a great honor to be asked to give this year's commencement address. And I want to start by thanking all the students and faculty members who encouraged me during the past few weeks, saying things like, "This better be good," and "You better be funny," and "We have very high expectations of you." Thank you all. It really took the pressure off. So, basking in the warm embrace of my colleagues, I started to search for an appropriate topic for today. Now, I'd been to 5 out of the last 6 commencements, so I thought I'd review the talks that I'd heard and see if I could get any ideas. And I realized that I couldn't remember any of them, not one. Now, that may be a good thing. Perhaps it doesn't matter what I say here today, which would make things a lot easier, but I couldn't count on that, so I did a little more research. And I found that medical school commencement addresses fall into certain categories. First, there's the "congratulations, you're doomed" variety, which is where the speaker welcomes the graduates to the profession of medicine and then proceeds to tell them all the things that are wrong with medical practice today, from excessive paperwork to government regulation to malpractice. And then they look the students in the eye and say, "And you will have to solve all these problems. Congratulations." I didn't like that, so I went a little further. Another common technique is the extended metaphor. Medicine is a ship that sails on the sea of disease. The patients are its sails, and science is its wheel. And yes, all I could picture were 1,000 iPhones coming out in unison as people texted their friends while I droned on. Then it hit me. What is the one thing people want to hear about more than anything else? What is the one topic that so fascinates people that they drop everything and listen intently? It's obvious. People want to hear about themselves. So this is going to be all about you. And I thought this is a great idea because what's the second best thing to hear about? Your children. So now I've got about 2/3 of the audience. The faculty are just happy to be out for a while, so they'll listen. But I'd had one problem, because what is the least interesting topic to hear about? How great your brothers and sisters are. So for all the siblings in the audience, you have my permission to get out the iPhones. Just try to keep it down a little bit. So now I had a topic. So I figured I'd open with a quote, something meaty and thought-provoking that would set the tone for the talk. So I went back to the greats of medicine, Hippocrates, Galen, William Osler, Albert Schweitzer, and nothing seemed to fit. So I finally chose a quote by Roger Daltrey of The Who. For the younger folks in the audience, The Who is a rock group that writes the music for CSI. And the quote I chose is, "Who are you?" And for those of you who want the reference, the full quote is actually, "Who are you? Ooh, 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 ooh." But I'm going to concentrate on the first part because I think it's more to my point. And the reason I'm asking each of you the question, "Who are you?" is because you are not the same person you were when you walked into this medical school. You are now a doctor. And you might say, "Yeah, I'm a doctor, but that's really my job. It's not who I am." And that's a very common sentiment, and it happens to be completely wrong. Don't panic. I know that nowadays it's very common to try to separate yourself from the profession and use words like balance and lifestyle to show that you're in control of the situation. And that is adorable, really. But it misses the reality of the situation. Now, I'm not telling you this to depress you or to frighten you, because, and here's the key point of my talk, being a doctor is the greatest thing in the world. It absolutely is. Now, some people in this room may disagree, and that's fine. And when you're giving the commencement address, you can talk about whatever you want, from ornithology to modern dance, and tell us how great it is. But not today. And you know what really amazed me as I prepared the talk is that no one really talks about that anymore. Everyone likes to complain about the problems with medicine, but no one really talks about how terrific it is. So let's take a few minutes to go over why this is such a great thing and why it changes a person for the better, in my opinion. Think about the privileges a career in medicine affords you. And I'm not talking about money. Yes, doctors don't starve, and generally they have financial security, and if civilization collapses completely, you're still going to get paid in chickens. So it doesn't really matter. I'm talking more about the intangibles. Intimacy, for example. And that's a strange word to use, but the patient-doctor relationship really is an intimate one. You are given access to the deepest secrets of humankind, the thoughts and fears of your fellow human beings, things that they might tell only their family and friends, but only might. You're also given access to people's bodies as well, cutting through all the taboos and cultural barriers against touching and privacy. And why do you get this access? Because people trust you to use this information for their own good and not your own. They don't know you, but they trust you to keep their secrets and work to help them. This is incredible. And it helps to step back and think about this, because even now it might be starting to become routine as you folks have worked in the hospital, in the clinic, and started to see patients. But always remember what a privilege it is. But you, as the doctor, also get something out of this intimacy. You get an education separate from your clinical studies. You learn about humanity. Most people have a family that they know intimately, and a set of close friends they know very well, and then some coworkers and acquaintances they know a little. But every day, you are going to learn about the millions of ways that life can take you, the joy and the sadness, the triumph over adversity and the terror of dying. My daughter, who just turned 16 this week, enjoys going to depressing movies with her friends and having a good cry. And then she comes back and tells me that I just have to see this movie, and I tell her no. And I thought that maybe I was alone in this, but I took an informal poll of my colleagues, and most of them do not go to sad movies. Why? Because art and literature help expose us to elements of the human condition that we don't experience in our daily lives. That's the beauty and the power of the arts. But we see these things every day, and we can't help but be affected by it. And that's okay. Our society seems dedicated to avoiding negative emotions as much as possible. But really, experiencing strong emotional reactions, good and bad, helps build empathy. And empathy is the cornerstone of being a physician. What medicine gives you is a continual appreciation of what life can bring and a perspective on your own life that other people may not have. And this is an awesome thing. Now, I don't mean awesome in the way everybody uses it, like this pizza is awesome, or the Red Sox are wicked awesome. I mean awesome, like in the Bible, which means great and terrible. It means huge and amazing and kind of scary. That's medicine. What else do you get from being a doctor? One of the richest intellectual atmospheres you will ever find. You are going to read about and talk about the cutting edge of science and technology, of course, but medicine also encompasses ethics and philosophy, politics and economics, sociology and psychology. You're going to be immersed in difficult problems, and you're going to have very smart colleagues to work with and talk to, and it's wonderful. I think many of us in medicine are not afraid of hard work, no matter how much we complain, but we're desperately afraid of being bored. So many people in this world have jobs they have to go to, but they don't enjoy. They live for 5 o'clock, and they live for the weekend. But you won't be like that. You're going to be challenged all the time. One of my favorite quotations actually is by John F. Kennedy, and he was talking about the space program, but I think it applies to medicine also. And he said, "We do these things not because they are easy, but because they are hard." We live for these challenges, and we're very lucky to have them. What you also get from being a doctor is respect. People love to criticize the medical system, but they still respect doctors. And they expect you to be smart and caring and be able to solve problems. And they give you a title, doctor, that separates you from everyone else. Your lawyer friends and your friends in business don't get a title. They do get a summer home and a boat, so I won't worry about them, but they don't get the title. And the issue here is that you derive a measure of respect just from the title you've gotten. And now, after being given this title today, you have to work to earn that respect. Many of my patients and several of my friends in the community call me Doc. Now, some of my colleagues don't like that. They find it a little disrespectful, but I disagree completely. I really like being called Doc. And I think it's both a sign of respect and an acknowledgement of who I am. Not my job, not my occupation, but who I am. It's not formal like Dr. Lowe, but it still conveys a sense that I'm a little different and I'll probably be expected to do more when bad things happen. And the fact that it's a nickname shows how seamlessly it gets woven into my life and my character. And that gives me great comfort and pride. And I hope that each of you will soon feel that way. So medicine is awesome, that's pretty clear. So now what should we do with all the respect and intellectual satisfaction and understanding of the human condition? Well, I have a few ideas. My sister Susan, who is 5 years younger than me, is a moral philosopher. That's not her profession, and she's actually never trained in philosophy. But since she was about 5 years old, she espoused a moral precept that I think encompasses most of the great ethical ideas, from Aristotle to John Rawls. If you've got this, you've got 80% of ethics down pat. When I was 10 years old, this didn't impress me very much, but now I try to live by this precept, and I've tried to raise my children by it. And here it is. Don't be mean. She said that a lot to me as we were growing up. Now I know what you're saying. Oh, what a letdown. I was expecting something deeper, maybe in Latin, maybe something Buddhist. Well, don't be mean. Everybody knows that. Do they? Really? I don't think so. And the reason I know that is that even today there is a medical riddle, a conundrum that gets bandied about both in the medical community and in the people at large. And here it is. Who would you rather have as a doctor? Someone who is very smart and can solve your problem, but who's very cold and unkind? Or a doctor who is kind and empathic, but less talented and who may not be able to give you what you need? And people hem and haw over this a little bit, and they usually choose the nasty jerk who is technically proficient. Well, the actual answer to that question is easier and actually more complicated. The answer is you don't want either one of those mokes taking care of you. You want a doctor who is smart and kind and proficient and empathic, and you should never settle for anything less. Not for you, not for your family, and not for your patients. Now, you're going to find people in our profession who have a special skill and may not be very empathic, and you may have to go to them, and that's okay. But what actually bothers me is when people say, well, he's a great doctor, but, and they talk about a lack of empathy. I would say that that person is great at something, but they're not a great doctor. We're much more than our body of knowledge and the sum of our skills, and because of all the privileges we get, we have a responsibility to be better than that, much better. So why would anyone be mean? We try to excuse it sometimes by blaming the stress and the hard work. And it is true. As you all know, medical school is extremely stressful for the faculty. It really is. Look at us. We're like shells of our former selves here. Does a sane person dress like this? I don't think so. And I imagine you folks have felt some stress at some point too, I imagine. I don't know. But stress is no excuse. We choose to do this. And we're committed to serving others. And that includes common decency toward our patients, of course, but also towards our colleagues and our trainees. And I want you all to remember that as you become teachers yourself. And being kind is just one of our responsibilities. All the great things about being a doctor come with a price. The idea of professionalism has become a big deal in medical education. There is a sense that doctors are driven now by a more selfish and business-driven ethic, and that we've lost track of our core values. So that there is a move to foster professionalism among students and residents. And there are now even several attempts to measure professionalism and perhaps find a number we can attach to our trainees so we can say, well, Gretchen got an 8.6 in professionalism, while Ari only got an 8.4. And for this talk, I'll be using very generic and nondescript names like Gretchen or Ari, so as not to single anybody out. I think that's a good practice. But so far, none of these scoring systems have panned out, and that's a good thing, because if we think we can reduce our professional values to a 10-point scale, we're in big trouble. So I have a slightly different view of our responsibilities as physicians. Our professional codes often read like a laundry list of virtues to uphold and vices to avoid, so generic as to sometimes be unhelpful. But I think of these codes more as safeguards to prevent us from using our powers thoughtlessly and accidentally hurting someone. Our powers? Yes, our powers. Because now, with this MD degree, with this title doctor or doc, you've been given something. With the title comes a gift to us from society and from our culture, and that gift is authority. Authority in matters of sickness and health, and in matters of life and death. And even today this holds true because when our patients try to scour the web and come up with information, they really can't do it very well. Not because we're smarter than they are, but because they don't have the context and the experience to apply that knowledge. And what's more, when a person is sick, they are not the autonomous and rational people who can absorb information, process it, and make cogent decisions. They are scared, and they are vulnerable, and they need help. No matter how much they want to be in control, and no matter how much we try to foster their autonomy. There's a great story about Franz Ingelfinger, who was a chief of medicine at Boston University in the 1970s and a gastroenterologist, and he developed esophageal cancer, and he eventually died of his disease. And when he was diagnosed, he took charge. He read everything he could about established treatments and experimental treatments. And his colleagues tell us that he drove himself crazy. And one day a friend and faculty member said to him, "Franz, you know what you need?" And Engelfinger said, "What? What do I need?" "You need a doctor." And Dr. Engelfinger found himself a physician that he trusted and ceded some of the responsibility and was able to live out his life with some comfort and some peace of mind. People need doctors. Doctors need doctors. I just read a terrific article by Jack Coulihan in the journal Health Affairs. Dr. Coulihan actually writes quite a bit about professionalism and empathy, but he was writing a personal experience. He was recently diagnosed with shingles, a painful rash that was across his shoulder and arm. And he knew what it was, but he went to the emergency room because it was a weekend and he needed some pain medication. It's a very painful condition. And when he got there, the emergency room doctor looked at him and said, "You have shingles." And he said, "I know." And he said, "Well, let's get a neurologist to see you just to make sure." And the neurologist examined him and thought he noticed an abnormality in the nerves of his face, which led to an MRI scan. And the MRI scan looked okay, but the radiologist thought there might be a subtle abnormality, which led to more scans and more consultations. And at the end of the day, it was discovered that he had shingles. The bill for this circus was about $30,000, and Dr. Coulihan writes that at every step he wanted to say, "Stop, I know what this is, we don't have to go on." But he was scared. He was scared what the neurologist said, and he was scared by the MRI finding, and he was unsure. So if highly trained, knowledgeable professionals like us have trouble making decisions when they're ill, how can a patient with a printout from a website take charge of his care? So we have to temper our respect for our patient's autonomy with a recognition of our own skills, our experience, and our power to help. But with our power, we have a set of rules that really keep us from going too far. So when people trust us with their lives, it puts us in a position where the little things we do and say, or don't do and don't say, have huge emotional valence. A smile, a kind word, a ray of hope, all have huge benefits. And a frown, a hesitation, a narrowing of the eyes can be devastating. When you were second-year students, you were all in Introduction to Clinical Medicine, and you were learning how to listen to people's hearts. I would watch you listen for heart murmurs, and you'd screw your face up really tight and look very pained. And you couldn't see the patient's eyes widen as they leaned back and looked up at me, and I would have to say, "Everything's fine." You didn't realize what power you had even then. We can alter our patients' emotional lives like nobody else, and it really takes a lifetime to get it right, and I'm still working to manage it. And because you have this authority, you will be asked about medical conditions by everyone you meet. I am a gastroenterologist, and at parties, I'll meet people for the first time who find out my specialty and then immediately confide in me about their constipation. My wife, Amy, has learned to recognize this even before it happens, and she disappears immediately, leaving me to extricate myself politely from the situation. This makes for a funny story, but less funny is when a friend comes up to you and tells you that one of their loved ones has been diagnosed with a disease, and you know immediately that this is a terrible disease, but they don't know yet, and they ask you for information. That's the true test of empathy, and it will happen to you if it hasn't already. But notice from these examples that medicine extends beyond the office and beyond the OR and beyond the hospital. You're a doctor now, and it's who you are all the time. It defines your role in society. It defines how you look at people and respond to situations. When I'm in a hockey rink going to watch my kids play, everyone else looks for the snack bar. I check to see where the defibrillator is. When you go to gatherings, you're going to scan the room and see who looks like they may get into trouble. And if they do, you will step forward when everyone else steps back. You will stop your car at the side of the road at an accident. And when everybody forms that circle they do around an injured person, you will break that circle and go in and help. You are a doctor all the time. And one of the basic precepts of our profession is that we put our patients' needs before our own. Now, this is a scary thought, because all of us have seen doctors who get consumed by their work and have no time for family, friends, or themselves. We react to this by backing off a bit and trying to stay detached, by trying to create a lifestyle that insulates us from being pulled in. And I've seen students and residents and even practicing physicians react very strongly to these precepts and say things like, "So if my mother is drowning and a patient is drowning, I have to save the patient and not my mother?" And the answer to this is that it really doesn't happen as often as you might think. And there's been a ruling and you're allowed to save your mom, but it's never that dramatic. And our professionalism does not get tested by crazy cases or the big issues of euthanasia and reproductive rights or stem cell research or all the hot button ethical issues. It is tested every day at around 5 p.m. when you want desperately to go home. Or maybe your college roommate's in town and you have dinner plans. And that's when a patient or a family member comes up and wants to talk just a little more about their spouse's new cancer diagnosis, or someone spikes a fever, or someone has chest pain. And we stay. Not all the time, not every day, not even most days, but enough to recognize the sacrifice. It's that internal struggle between self and profession that occurs all the time. And there is nothing wrong with striving for balance. You need time for yourself and for your family, and you have smart and dedicated colleagues who can cover for you. I personally take pride in the fact that I've made time for my family and my life outside of medicine, but I'm not detached, and I know I will be inconvenienced sometimes, and that's okay, because I love being a doctor. I love it. I don't love every minute of it, and there are some days I'm not overjoyed, but I love it. And you should not be afraid to love it either. There are two ways to approach medicine. Medicine's a big pond, and you can just sort of stick your fingers in and splash around a little bit and then shake it off and go. Or you can jump in, immerse yourself, swim around, have a great time, and then get out, dry off, do something else, and jump in the next day. If you do it that way, even when it's challenging and exhausting, it's not like work. And that's what I wish for each of you, that you never have to work because you love what you do. And so to conclude, I again want to thank the class of 2010 for giving me this opportunity to speak to you today. It is a great honor. And I'm really looking forward to hearing about all of you as you go on with your lives, both inside and outside of medicine. And now I'm supposed to leave you with some words of advice. So here goes. Don't be mean. Love what you do. And if you don't, then do something different. Medicine is big, with lots of opportunities for redefining yourself. And you've worked too hard to feel unhappy and trapped in what you're doing. And please, don't be afraid to jump into medicine. Just make sure you know where the ladder is so you can get out. In short, be a doc. If you do, you're going to find that life is huge and amazing and kind of scary. In other words, it's awesome. Thank you very much.